So one of the ways that I like to consider the patient in front of me when I'm treating people in the clinic, but also when I'm thinking about my research, is this concept of patient-centered care and thinking about the socio-ecological framework. So this places the person in the middle, their behaviours and their treatment choices. They'll be influenced by a whole range of intrapersonal factors, which we can influence as clinicians. And they're also influenced by a whole range of interpersonal factors. So we're not just talking about our role as healthcare professionals, but a whole range of social influences, friends, family, colleagues, etc. And then also media portrayal of the condition. We also know that environment plays a big role, so natural environment and built environment and infrastructure, but also the healthcare environment of what services might be available. So when we're thinking about why don't people engage in appropriate exercise therapy and engage in active management of physical activity, this is a nice way to frame our considerations. So what do people with knee osteoarthritis do? We know most don't meet physical activity guidelines. In fact, most people in general don't, but people with osteoarthritis in particular are less likely to meet physical activity guidelines compared to the general population. In Australia and all around the world, most people also do not engage with appropriate first-line care, so that being education, exercise and weight management where indicated. There's a whole range of factors that might link to this in terms of intrapersonal factors. So beliefs about osteoarthritis, we see this pervasive impairment discourse where people believe the condition is wear and tear disease. They've got fear of pain and damage with exercise. They believe exercise is dangerous. They underestimate the benefits of exercise, and many people also believe that surgery is inevitable. They often have limited knowledge about the condition, and in particular limited knowledge about treatment options and the benefits and safety of various things. So they may overestimate the benefits of things like surgery and injections and underestimate the potential harms, and the opposite for exercise and physical activity. And they often have limited self-efficacy, motivation, and that capacity to self-manage, particularly in relation to exercise and physical activity. So quality education to address many of these factors is really, really important for us to consider as health professionals.